Marginal bone loss is an important parameter for implant success and tissue stability in the long term. In the past, many have used annual thresholds of bone loss, for example 0.2 millimeters, to define implant success over time. But is the rate of bone loss stable over time? Should we expect a similar annual rate of bone loss every year around healthy implants? And if not, what could accelerate or slow down the marginal bone loss? We use data from peri-implant bone levels of patients with clinically healthy peri-implant tissues and studied a large number of clinical variables to answer this question. These patients had implants followed up from 1.5 to 7 years, with loading time points varying from 1 month to greater than 2 years after implant placement. We calculated the rate of bone loss in 3 different time frames: preloading, postloading, and overall placement review. As expected, the biggest change in the rate of marginal bone loss takes place in the preloading phase, where bone loss starts fast but soon slows down significantly. Interestingly, between patient variability was highest for preloading rate of bone loss. Bone augmentation resulted to a lower preloading rate, while earlier loading was related with a lower overall rate of bone loss. Most importantly, the rate of bone loss at the preloading phase was a good predictor of the overall bone loss in the long term. In conclusion, the rate of pre-implant bone loss is not stable over time and cannot be correctly reflected in annual intervals. Bone loss appears to occur faster and slower at different time points. A fast early preloading bone loss rate may identify bone losers or patients at risk for lower marginal bone levels in the long term.